everybody. Welcome back. We've taken a little break from webinars lately, got through the holidays, and then kind of came back to the office and regrouped after the holidays for this long month. But anyway, here we are today. We're going to talk about advanced dermaplaning techniques and protocols. We've got Lori Moore with us. She is coming out of Huntsville, Alabama. Lori is a licensed esthetician instructor, as well as a licensed master esthetician, so that's really cool. And she's also an instructor with Dermaplane Pro, so she kind of knows a thing or two about dermaplaning. So we're really excited to have her today. Then we also have Darla. I'm sure at some point, if you are one of our clients, you have spoken with Darla on the phone, emailed her, or texted her. She is all over the place. She's our general manager. She handles all of our esthetician accounts, as well as the UK. So she kind of has a lot going on. And because she has had in the past wholesale accounts and things like that, she has spent a lot of time talking one-on-one with skincare professionals, asking what they want to know about, what they are facing in their day-to-day practices. So she brings a wealth of knowledge to the table with that. So that said, let's go ahead and get started. And Lori, you can have the floor.
Hi, everybody. I'm so happy to be here. Thanks for inviting me, guys. This is really exciting because dermaplaning is what I have kind of built my practice on. It was one of the first techniques that I learned in school, and I absolutely fell in love with it. It is an instant gratification kind of procedure for those of us in the practical room, and it's instant gratification for our clients as well. So today we want to talk about the benefits of dermaplaning, how to build those advanced protocols, the importance of great supplies, great back bar items, great utensils to use, those things that are really going to give us the best outcomes possible, and how to build a protocol going out and not just having your client come in and having the same treatment time after time, but how to really get that effective client problem resolution that they're coming to you for, how to do that. So let's talk first about the benefits of dermaplaning. The one thing that I love about dermaplaning is the first time a client comes into my treatment room, I can put them on my table regardless of their fits type. So dermaplaning can be done on all skin fits types, 1 through 6. It's safe during pregnancy and while nursing, while some of our treatments we have to kind of scale back and can't do them on people who are pregnant. This is one of those that they can come in and enjoy while they're going through pregnancy. It's, like I said, it's immediate gratification. It's removal of that vellus hair that your client sees, and that's what they love. But for us as estheticians, what it does is it takes off that top layer of dead skin so that we can get penetrate our ingredients better. Those really expensive serums that we all love don't get trapped in that vellus hair and in that dead skin and sit on top. Dermaplaning allows those ingredients to go down deep and create change in the bottom layer of the epidermis and into the dermal layer where we're creating new collagen and elastin. It's highly effective at minimizing fine lines and wrinkles. It plumps the skin while they're there on the table. So when they leave, they don't just leave with a glow, they leave with a little bit healthier looking skin. So those fine lines and wrinkles look diminished right then. Now that's not a long-term effect of dermaplaning. It takes that great home care and other treatments to help maintain the look of the minimized fine lines and wrinkles, but it is one of the instant gratifications while they are there. There is no downtime. Your client can come in during lunch. I love a great 30-minute lunch facial and dermaplane the client and have them out the door. If you know what you're doing, they're not leaving with road rash, which we're going to talk about why it's important to incorporate those advanced techniques, because when we learn to dermaplane dry, clients often leave red, and that's not the goal of the treatment. The goal of the treatment is that great glow that we see all over Instagram. So they can walk out the door and go right back to work, and nobody knows they have had a treatment done, except they look at them and go, oh my gosh, your skin looks so great. What did you do? And that's a great way for them to promote your business. When your client leaves and they look fantastic and people ask them, they're more likely to say, oh, I went to Lori and had this great facial, than if they leave and they can't really tell anything's been done. But the best reason that I love dermaplaning is it's a great treatment to build. It's a foundational treatment to build your protocols on. It's great for treating your drier clients, your more mature clients, your acneic clients. There's really not a skin condition that it's not great for. We've got a slide at the very end that talks about contraindications, but I'm going to touch on them really quickly so that you know going in what clients you can and can't treat. We talk a lot about being able to dermaplane clients with rosacea. There is a caveat to that. We don't treat anybody who is under the treatment or under the care of a physician, especially a dermatologist, for a skincare condition. So if they are taking, I get a lot of people asking me, my client's taking Metrogel or using Metrogel, can I still dermaplane them? And the answer for me is no. Metrogel is used to treat Demodex. It's also used as an antibacterial to kill bacteria on the face that could be causing the rosacea. So if you've got a client under the care of a physician and they're using Metrogel for rosacea, then rosacea becomes a contraindication. If they have uncontrolled diabetes, their skin does not heal as quickly. So we are using a surgical scalpel on their face, and the chance that you might nick them, they don't heal as quickly if their diabetes is uncontrolled. So they are a no. Blood thinners as well. We don't want anybody bleeding if we nick them. So if they're taking blood thinners, including aspirin, they're contraindicated. If their skin is compromised from cancer treatments or radiation, I just recently went under some radiation treatments on my hands. My hands didn't contraindicate me for dermaplaning, but radiation and cancer treatments, they do need to get a release from their physician if they're taking Acetone. So Acetone is a no for a year out after treatment. The skin is thinned, it's more sensitized, and Accutane is a no. Retinols and Retin-A, they should stop. I have my clients stop 5 days prior to their treatment. Know that with Retin-A's, you're usually looking at an acneic client, so we've got other things to consider in there as well when dermaplaning that client. Grade 3 acne and above, all estheticians need to be sending grade 3 acne and above to a dermatologist or to their physician to treat. I know that's kind of a soft spot, and we want to think we can treat all grades of acne, but really that's outside the scope of a regular esthetician. Grade 3 acne and above, we are not going to dermaplane those clients. Sunburns, windburns, and my favorite is hay fever. A lot of people don't think about people with hay fever. If they are sneezing, they're not on my table with that surgical scalpel. Also, we are never going to dermaplane somebody with a history of cold sores without pre-treatment. If they come in with a cold sore, it's a definite no. And if they have a history of cold sores, it is pre-treatment 3 days prior to coming in. So it's very important that you go over that client consultation card. It's very, very important that you document each time they come in if they've had a change in history, medical history, or a change in their prescriptions. And that's very, very important when you're taking a surgical scalpel to somebody's face. I tend to teach very quickly. There's a lot of information to cover. So if I'm going really fast, Darla and Christina are welcome to tell me to slow down. You guys are welcome to put a question in, and Darla and Christina will direct that to me if you have a question while I'm going through this.
Hey, Lori, I do have a question. You'd mentioned the Fitzpatrick.
Yes.
A lot of people are, get concerned about being a different Fitzpatrick, that doing a dermaplane on them might make their skin tone uneven. Also, if they don't do a thorough job of dermaplaning the whole face, will that make it uneven skin tone doing a higher Fitzpatrick?
So what it will do when you leave that dead skin on there and you miss it. So I'm like the grocery store girl and in line at the grocery store looking at everybody's face. And definitely in a higher fits type, if you leave that dead skin on there, it's going to look dull, dehydrated compared to that glow of the rest of their skin. Is it a permanent thing? No. But what happens a lot in higher Fitzpatrick types is hyperpigmentation because of the friction that we're creating. So this is where retailing your back bar or your home care products really come in handy. And retail should be 50% of your profit in your spa. You should be getting that residual income from your products, not because we love money, which we all do, but because they help your client get the results that they need. So having your higher Fitzpatrick types, it's incredibly important to have your higher Fitzpatrick types 4, 5, and 6 pre-treat with home care before they come in to be dermaplaned. And part of that home care should be a melanin suppressant. I love Kojic and L-arbutin. I love the Enlighten and Brighten by Theraderm. That's what I personally use. There are others that you can use. I'm not a big fan of hydroquinone. I know a lot of higher fits hear that in their spas. And for me, knowing what I know about the fit scale and higher fit skin, I prefer using a Kojic and L-arbutin. There's less risk of a rebound hyperpigmentation after long-term use. If you are going to use something more aggressive than L-arbutin and Kojic, then you really want to shorten that time that you use it. But I think using something longer term, very few of my clients that are higher fits come in a 6-week time period and then don't ever come back. So I have them on something that they can use every day that's non-toxic, that helps even their skin tone and isn't necessarily going to cause hypopigmentation. It doesn't affect the melanocyte to the point that it kills it, and they're not creating melanin. It just kind of tamps it down and makes a more even skin tone. So it's really important to know the ingredients that are in your home care products and are on your back bar. Does that help? Did I get your question, Darla?
Yes. It was just, you know, anytime you're doing something with the Fitzpatrick and the darker skin, you know, I was just curious if it would uneven the skin tone or if they had to, you know, really watch things. But that was great. Thank you.
They really do, because if you are an aggressive dermaplaner, if you are using a lot of friction, if you think you really have to dig down in there to get an effective treatment, when you're doing a higher fits type, that can really excite the melanocyte and cause overproduction of melanin. So you can, if you see that happening in your practice, they have a dark spot on their cheek or a dark spot on their forehead, you are going to want to look at your technique and back your technique up, because more than likely it is the pressure that you are putting on the skin that is causing that uneven skin tone.
Okay, great. Thank you.
So let's talk a little bit, since we've touched on the importance of home care and the importance of pre-treating. Let's talk about the equipment that we want to use and have in our rooms when we do dermaplaning. So let's start with blades. Blades are so very important. In school, we usually learn with the cheaper blades. They're usually surgical scalpels, not designed technically for dermaplaning. What I use in my practice, and I'm going to put it up, you guys tell me if you can see it. But what I use in my practice, Darla, can you see that? I can't hear you.
I know, sorry. I said I can barely see that.
Let's see. That helps?
That's better. That's better.
There you go. So it is a butter blade. It is designed for dermaplaning. Theraderm carries butter blades. They are awesome. Stainless steel is not as strong as carbon is. And that carbon, what it does, it gives you, you're not going to have that weaving or floating action that you have on some of your cheaper blades. So while you are building your practice, I tell all of my students, you do what you can afford. But when you can afford better, do better. Go for that carbon blade that's going to give you the strength, that's going to give you more of a surface area to use. It's going to give you more even. It's not going to wear out or dull on you. And that's very important, because what I find, and going back to the higher fits types, by the time you get down to the neck and the chin, people are having to apply more pressure because their blade has dulled. And you won't have to do that if you invest in a good blade. Something very important to touch on, in Alabama, we are not required to wear gloves. And dermaplaning is a blood exposure procedure. I recommend that every esthetician that performs dermaplaning wear gloves for the safety of your client and for your own safety. So that was just an FYI. What I love is a really great cleanser, Dermaplane Pro. I'm a trainer for Dermaplane Pro, and I absolutely love being a trainer. And we are not a product specific or a product backed company. So you can plug in your own back bar. So I use Theraderm's cleanser. It takes off all of the dirt and debris without stripping the skin. We want to start with the healthiest skin possible. So make sure you're using a great cleanser when you do that. Dermaplane Pro does offer a great AHA, BHA toner. So we have an alpha hydroxy and a beta hydroxy. And what that does, the alpha hydroxy adds hydration. The beta hydroxy adds a little bit of a antiseptic quality, anti-inflammatory property. But Theraderm, you could easily switch that out with whatever you have in your back bar if you have something similar. I love Theraderm's toner. I use it every single day. I use their back bar and I use their home care products. But at Dermaplane Pro, we do use an AHA, BHA, and there is, you know, just a slight difference in theory there on why they use that product. But having a product that is going to plump the skin, that alpha hydroxy that's going to hydrate, because dermaplaning dries the skin. We're going to lose that transepidermal water loss as we're taking off that top layer of skin. Your patient's going to become, or your client's going to become dry and irritated. So if we can hydrate the skin prior to causing our controlled wound, then your client's going to get a better outcome. So make sure that you're using a great toner. I personally love to use oil when I dermaplane, and Dermaplane Pro has a fantastic oil that we use that has a lot of anti-inflammatories, antioxidants, is very, very nutrient rich. But we all know that we have clients who are acneic, especially if they have cystic acne or they've had a history of acne, who do not want an oil put on their face. So Darla and I have talked. Darla prefers to use the OPC serum from Theraderm, which is fantastic. Do you want to talk to that point, Darla?
Well, and the reason that I like the OPC to, you know, as the slip, because kind of my own skin, and like we had talked, I know the product from Dermapro is great, and a lot of people like that oil, but as far as my skin, I would break out because I'm real normal, and even in facials, if they put too many creams on my face, I break out because I don't need that much hydration. So the oil on me personally would cause me to break out. So I like the OPC because, you know, you were talking about repairing at the same time, and that's what the OPC does. So, you know, either way, I mean, Dermapro, you know, trains with the oil, and that's great, but sometimes not every client can use, you know, the certain protocols. So that's why I like to do the OPC, just because on myself, you know, because I don't want breakout, because I don't want to put too much on my face, and I feel like the oil is too much for me.
So client retention is really huge, and you don't want to lose a client who has struggled with acne in the past simply because they don't want to put oil on their face. And if you think about it, you lose the client. Dermaplane Pro or Theraderm lose selling the back bar items to them. They lose selling back bar items to me because I've lost a client, or the blades. So as much as I love the oil, I want to retain my client, and so I try to work with that client. There are very few clients that I've ever had any problem with, but know that not everyone is for every specific protocol. So be careful with what you use. Know the ingredients in the oil so that you can talk to your clients about them. It's a really great, nourishing, hydrating, really helps with not losing that transepidermal water loss. But to the OPC, you're, like Darla said, you're already putting that healing product on. The only difference in the protocol would be you would do the OPC in quadrants because their skin would absorb it. And if you put it all over at the first of the treatment and then dermaplane the whole treatment, by the time you got down, they would be dry again. So if I were going to use OPC, I would use it in quadrants where you can use the oil on the entire face.
Okay, I didn't know about the oil on the entire face, but yeah, anytime like I do sections, you know, I just put the OPC on the part that I'm using and don't put it over the whole face. But that's good to know about the oil you can, because I didn't know that.
Yes. So let's see here. Where am I at? Cleansers, oils. So we've talked about having the great utensils, the great things to work with as far as the blades and our back bar. So let's talk about building those advanced protocols. Let's talk about how to incorporate dermaplaning and other modalities in our treatment room. I love, love, love. I'm a little bit older, so I tend to be more dehydrated, more dry, and I need those great humectants, those great hyaluronic acids that hold 1,000 times their weight in water in my skin to plump my skin and help me look healthier. And the number one thing I love is ultrasound. Ultrasound is great for your more mature, UV damaged, especially thicker skin where we're really having to push product down deeper to get it to where it needs to work. I love dermaplaning and ultrasound. It's one of those that's very relaxing. I love it in the wintertime. It's warm. The ultrasound heads get warm and my clients usually go to sleep and they leave with an incredible glow. So pre-party, if you're not going to do a peel, ultrasound is one of those that you can add into your protocol that's really going to help. We talked about our acneic clients. An all-time hands down favorite for me is high frequency. I love dermaplaning and adding high frequency. Now that we've got the dead skin that's off of grade 2 or below acne, and we don't dermaplane over papules and pustules, you dermaplane around those. But if they've got hyperpigmentation or the residual skin that's left over after they've dried out the acne lesion, you can dermaplane those and then put BPO on it, benzoyl peroxide, spot treatment, and use high frequency, and it helps really to clear up, dry up any of that residual oil, and it leaves your acne clients feeling like they've actually done something to treat their acne that day. And it lasts for several days. So we decrease oil production, we're drying out that gland or that the sebum in that follicle, and it really does. Your acneic clients are going to love if you add high frequency in. One of the things that I love with all of my advanced treatments is incorporating an enzyme peel. I love, love, love. It's my #1 seller. I give it away at almost every one of my chemical peel 201 and 202 classes, and I give it away a lot in my Dermaplane Pro classes, is new peel. And it comes in Dermaplane Pro actually puts new peel in their packs that every student gets. And in the pack for the cost of the class, you get a kit that will allow you to do about 20 treatments. So you by far make your money back through the kit. But in that kit is a bottle of TheraDerm enzyme. I put it on dry, do my, let it marinate for a minute and watch it peel off. Your clients love watching all of that skin peel off. Then I cleanse. And then I'll do another enzyme peel. I'll reapply the new peel and apply steam. For your acneic clients, that's huge. You get the action of the enzyme going deeper, then you can do high frequency. So you really can, adding that enzyme into your protocols is really going to give you a lot of flexibility. It's also, the enzyme is great to do before you do chemical peels. If you're working with an acneic client and you get the inflammation out, you get some of the pustular acne down, and you can do a chemical peel is a great way to do that. A Jessner's peel is fantastic because the salicylic acid actually goes into the pore, and it loosens up the skin cells that are stuck down in there all together, creating all the gunk. It gets that out, and a good Jessner's peel, a good salicylic acid is going to slow down sebum production. So combining your enzyme peel with your chemical peel, and then once you get your acneic client to where they're down and they're not as inflamed, then you can add dermaplaning. We never dermaplane around cystic acne. We never dermaplane pustules or papules. Anything that you can break open and slide that bacteria across their face, that's a no. But if it's the residual that's left over, we tend to dry out our skin a lot. When we're trying to dry up our acne, I'm really bad about that. I had cystic acne, and whenever I get a breakout, I just want to dry it up just as fast as I can. And once it is dry and you've got that gunky skin left, dermaplaning is an excellent option for that. Microdermabrasion. Darla and Christina and I were talking about this beforehand. Microdermabrasion is one of the things that almost every esthetician can do in her practice, and microdermabrasion is great to combine with dermaplaning. I am very cautious when I combine these two physical exfoliants. You can see a lot of road rash if you are doing dermaplaning and microdermabrasion together. I highly encourage you to turn down the suction on your microderm machine and work with less suction. You can do more passes. Research is showing that that really increases the collagen and elastin production anyway. That higher suction does more damage. So if you're working with crystals, that's a whole different ball game. But if you're working with diamond tip microdermabrasion, adding that with a dermaplane is going to give you excellent, excellent results. What I would do is dermaplane first, then dermaplane and add microderm in my second treatment with an enzyme peel. And then your third treatment, depending on the reactivity of their skin or the sensitivity of their skin, that's when you can start adding in that chemical peel. That's when we can really start seeing dramatic results and getting results for the clients for the condition that they come in for and they're looking for treatment, and not just the basic facial with massage.
Lori, I have a question real quick.
Yes, ma'am.
Does ultrasound include radio frequency?
So radio frequency, if I understand that right, I don't have radio frequency in my room, but I have talked with several people about purchasing a radio frequency machine. Ultrasound and radio frequency are different, and I would check with the manufacturer of your machine before I would do ultrasound or do radio frequency with dermaplaning and see what they recommend. Radio frequency usually dries up, or my understanding, radio frequency usually dries up like skin tags or closed comedones, those types of things. It'll clear up cherry angioma, it'll clear up telangiectasia. So radio frequency is going to be very drying. And I would be cautious of doing that with dermaplaning. But again, I would check with the manufacturer of your radio frequency machine.
Okay. The other question before we kind of go on to a few things, one question was, what do you feel about using acetone to prep the skin? I know I'm asked that a lot.
A lot. I am not a fan. I want your skin to be the healthiest it can be prior to dermaplaning, and acetone is kind of old school, and it is, in my understanding, it's very stripping. It is not going to leave me with that healthy skin that's hydrated. And I would much rather dermaplane a peach or a plum than a prune. So I don't want all of those wrinkles. I want as much hydration in that skin so that it plumps the fine lines and wrinkles before I ever lay a blade to it. And then once I use that surgical scalpel, I want as much hydration in there, because we are losing water at an exorbitant rate once you take that top layer of dead skin off. Transepidermal water loss, and it causes irritation, which in turn excites your melanocytes, it excites your sebaceous glands. So I want the least amount of melanin produced, pigment produced, oil production while I am dermaplaning. So I'm not a fan of acetone. It's people have been doing it for years and they love it. I prefer a great alpha hydroxy acid or that combo AHA BHA, that AHA Baha toner to an acetone every day.
Thank you.
But I get asked that a lot.
Yeah, I do too. And I thought it was pretty old school, but you know, the thing of it is some people that's the way they were trained, but I don't think it's healthy for the skin to use that.
Right. It's very, very stripping. So I personally wouldn't use it. If it works for you in your practice, I would encourage you to take a Dermaplane Pro class. I encourage every one of my students. So I'm a licensed instructor. I'm in the classroom teaching every week. I always encourage my students to take those advanced classes or continuing ed classes. You may not learn anything new. You may learn something new and you may disagree with it. But knowing that what you are doing is up to date, is science-based still, those are important things. And acetone is one of those that served its purpose when we did it, but now that we know better, we do better, is my opinion on acetone. So the next one on the slide should be facial cupping, which is one of my hands down favorite new treatments. It is a form of lymphatic drainage. There's some controversy about it. I don't do deep, I don't look like Michael Phelps when I'm through. I don't have the suction cup hickeys on my face when I do lymphatic drainage doing facial cupping. I think it was in Skin Inc. just this week, Darla, that they came out with a study for 2019, and lymphatic drainage massage was the #1 searched facial on Google, and it beat Botox. So our clients are looking to incorporate lymphatic drainage. Our face does not have pumps to get the lymph out, so we tend to have those puffy under eyes. And our face can look dull from all of the toxins, and lymphatic drainage really helps you get that out and get vibrant, healthy looking skin. So I love to do facial cupping. I will do facial cupping prior to dermaplaning. It plumps the skin. It brings all of that blood flow and oxygen to the surface. I tend to back down on the suction itself, and I back down on the number of passes that I do, as well as the strength that I push down on my blade. But I can get a fantastic facial out of facial cupping and dermaplaning at the same time. So know that, because if you're going to do cupping, you're bringing that blood flow to the skin. You're not wanting to press as hard with your blade. We're not wanting to cause as much friction. So it's kind of a balancing act. It's one of those that you're going to ask every friend that loves you if you can put them on your table and practice on you, as well as anytime you're learning a new procedure. But especially with dermaplaning, I often recommend that my students find 5 people to practice on first, and then offer it as a half-price special for the first 5. And by the time that you have 10 under your belt, you feel pretty comfortable with that blade. But with facial cupping, that's one of those that you want to be careful with, but it absolutely produces fantastic results.
Is there classes that you can take for the facial cupping? Because I was asking you, going, oh my gosh, does that not leave hickeys? I mean, because when you see it done on your body, you
right,
have a big suction, and I was like, is that not going to damage the skin? And you were telling me no. But is there classes that you can take for facial cupping?
So this year, and in the next couple of months, we're going to be adding classes. I teach at St. John's School of Aesthetics in Huntsville, Alabama. So all of my students that are watching, or I think the owner of the school is watching, hey y'all, that's one of the classes that we're looking at adding is facial cupping. It is hard to find a class on that. Now, can it damage the skin? If you are in there with the suction cups meant for the body, so you need to know what you're doing. There are special suction cups for the face. If you are using suction cups meant for the body, you can absolutely pull too hard. If you are an esthetician that believes more is more, and now come on, you know us, suction cup therapy or facial cupping is probably not for you. This is a mild treatment. It is meant to be used, I don't do above the orbital bone. I'll do suction and release, but I'm not sliding that cup and pulling that fine skin. There are different philosophies on it. I tend to have small telangiectasia on my face. I've been cupping for almost a year, and I have not noticed any increase in broken capillaries on my face. So for me, I even had a student last week go, Miss Lori, I don't know what you're doing, but your 11s look so much better. My children used to ask me, why do you look so mad all the time? So facial cupping is a form of fascia release, and it has really dramatically, I feel like, changed the deeper lines on my face. Now, I was a sun worshiper, baby oil, iodine, and a tanning blanket all through my teenage years. So I have a lot of damage, and I don't Botox. Like y'all can tell, I don't Botox. But the facial cupping has really, I feel, and I've gotten a lot of compliments lately about my 11s are really starting to even come out a little bit and even out. And so I personally love facial cupping. My clients that I see in my treatment room have all raved about their facial cupping and lymphatic drainage massages. So it's one of those, because you're bringing the blood flow and the oxygen to the surface, you can combine an oxygenating treatment with it. And really, they walk out with this pink, rosy, I call it my red carpet facial, because you walk out with that glow and you walk out with color to your face. And so a lot of, if you read a lot in your like variety magazines or your, you know, Hollywood star magazines, a lot of them will have lymphatic drainage or facial cupping prior to going out on the red carpet, because it gives them such a great effect. So hydrofacial, let's talk about hydrofacial for just a minute. I don't know anybody in the industry that does not love hydrofacial. Hydrofacial treats every, I mean, it solves world hunger, basically, is what it does. And it is such a great modality, and it is, it's combined with dermaplaning. It is a fantastic thing. So it is one of those that you can do dermaplaning prior to, then do a hydrofacial to really get in there and suction that out. Talk with your distributor for hydrofacial. Find out which of the serums and what all you need to use and what all is best for your client. Know those ingredients so that you're not using your more aggressive ingredients after you've taken off that top layer of skin. One of the great things about dermaplaning and using all of these modalities is learning how to build them into your protocols, and LED light can be one of those things. It is such a great modality to use if you have somebody with sensitive skin or somebody who's very reactive and you don't want them, they've turned red in your treatment room, and you're like, I don't want them to leave, and have somebody ask them who did that to your face. Using that LED light treatment after dermaplaning can really calm and soothe them. I know that I have heard that TheraDerm might be working on a mask, and I would love to see that post-treatment. That's something in my treatment room that I would love to have from TheraDerm. But if you've got somebody who's very reactive, use a mask on them. Dermaplane Pro offers a fantastic mask. It is a cellulose mask. It has incredible hydrating ingredients, nutrients, anti-inflammatories, antioxidants. They throw a little bit of everything into it, and you leave it on for 10 minutes. There's enough in the pack that you can kind of squeegee it out and send your client home with that second treatment. So doing a facial mask and then LED light treatment, if you know they're sensitive before, or they come in red before, you can do LED treatment before and after. You can do it both ways, before or after, either one. I happen to love it after. I don't want my sensitive or reactive clients going home red. I want them going home glowing. So I incorporate that LED light when they are leaving my room. So let's go back real quickly, because it's very important to those contraindications. It is so very important for you to cover yourself with your insurance company and going through that intake form every time. I can't stress that enough. You are going to have clients who want that treatment, who want dermaplaning. They saw it online, they saw it on Instagram, they know they're taking Acetone, they know that their diabetes is not under control, they know that they're still using their Retin-A, and they are not necessarily going to tell you the truth. So knowing your contraindications, knowing what they are, asking your client if this applies to them, and having them sign your client consultation form, not the first time they come, not every 5 times they come, but every time they come into your treatment room. Has anything changed? Are you experiencing these symptoms? Cold sores, hay fever, windburn, sunburn? Are you a tanning bed fanatic? Those types of things are really going to help cover you with your insurance company, and they're going to help you give your client a better treatment. But if your client does not tell you the truth and you perform the treatment and they're very reactive or become very sensitive, you have then, there's one layer of buffer between you and any kind of lawsuit, because you've had that your client signed that you went over this with them and that they did not have those contraindications to treatment. So really, really, really write them down, put them on your treatment table, do whatever you have to do to remember what the contraindications are, and make sure that you're following that when you treat your clients. Make sure that if they've had injectables, whether it's Botox or fillers, that's a 5 to 7 day window as well. And I don't think I put that on the slide, but you don't want your client getting Botox or fillers and then you come in, because while I'm working on you, I'm pressing your skin, I'm going around, especially if I'm doing Dermaplane and Microderm, we're manipulating the skin. You don't want them leaving your room and moving their Botox or their filler around and they look all wonky. So know that you need to wait 5 to 7 days post injectables as well. If they are using strong Retin-A, I like to have them off at least a week, if not 2 weeks prior to dermaplaning, because the heat from the friction and their skin's already sensitized. I have very few clients who are on Retin-A because they are under a physician who come to me for dermaplaning. I just don't have that. But a lot of our skincare lines use a lesser form of Retin-A, and there's retinols in a lot of what we give to our clients. So if they're on a retinol for home care, that can be 3 to 5 days, depending on how well you know your client and how compliant they are. But you do want them off of any form of retinol in those days coming up to your treatments, especially if we are doing those advanced treatments and combining enzyme peels and chemical peels and dermaplaning, and we are doing multiple forms of exfoliation on skin that's already thinned from those prescription Acetone or Retin-As. So did we have, the slides. Oh, great. So your pre and post dermaplaning pictures. I love that. It's not just great for Instagram and Facebook. It's going to get you a lot of clientele if you're posting pre and post pictures. It's also great for covering you with your insurance company. So if your client goes home and all of a sudden she looks like she's been mauled by a million cats, you can say, this is how she left my treatment room. This did not happen with me. So that great glow is what's going to get you clients, but those pre and post pictures are really, really important. The bottom pictures are actually me, and it's kind of horrifying to see that in my 40s when I went through menopause, in my early 40s. So I went through menopause really young and I had cystic acne. The picture on the left is during that cystic acne, and I had 13 products on my countertop to fight that acne, and it just was not working. So that is when I found Theraderm, and I went to 5 products in the basic daily care, and I added in lactic acid. I didn't use Chestnur's peels at the time. I had severely dehydrated my skin. So adding the hydration back in along with home care products actually helped clear up my acne. I did use New Peel, love New Peel, and I used the BPO spot cleanser. I'm a little red in that picture, a little flushed. I had done cupping in that picture and an oxygenating treatment. So lots of oxygen in the skin to help fight that bacteria. But it took less than, I want to say, 4 months to see drastic improvement in my skin from cystic acne when I started using the Theraderm daily care, home care products, and incorporated peels in with that, as well as the BPO. I do send my clients home a lot with their reversion kits and have seen dramatic results with that. But for me, if you're asking what I did, if you're wanting to know what I did to get those results, I didn't dermaplane my face until we got that cystic acne under control. And dermaplaning dry sent my acne into hyperdrive. And when I dermaplane my face now and I use oil, it doesn't break me out, but I always use new peel immediately after. And we teach that in the Dermaplane Pro class, doing that enzyme peel and getting the oil up off of the skin immediately. But that's what I did. I switched my home care. I switched my acid that I was using on my face to the straight acid from TheraDerm, the straight lactic acid, and I incorporated, and I love the BPO from TheraDerm. It wasn't as harsh as the one, so it didn't have as much benzoyl peroxide in it. And remind me, Darla, I went blank. What is the other ingredient in your BPO spot treatment that I love so much?
Yeah,
I always mispronounce it. Kaolin? Is that it? How do you pronounce that, Christina? Anyway, it's fantastic and you'll love it, and it's what I used. So let me see, I should have it right here. Spot treatment. So it's Kaolin. I always kill it. So I say kaolin, but that's probably wrong. Don't keep me on that. But it really does help dry it up, and it's not as harsh as some of the other ingredients. So that was how I cleared my face, and that's what I love. And now I can dermaplane because I pre-treat my skin. I stay on that great home regimen. I pre-treat my skin, and I also use the Enlighten and Brighten to make sure that I don't hyperpigment. How are we doing on time, Darla?
I think we probably need to wrap it up. I think we answered all the questions.
Perfect.
That was great. I think next week, if Lori's going to come back with us, I kind of want to talk about more into the microdermabrasion and dermaplaning. So I think that's what our next week topic is going to be about. But I would love for everyone, if you have topics that you want to talk about, send me an email. Let me know, because we'd be glad to add them. I'm working on our calendar for the year. We want to talk about things that you are dealing with in your practice, what can help you, even if it's to marketing or different procedures. And training is very important. And Lori, you know, like she is a trainer for Derma Pro. So you can get training from her for dermaplaning. And if you're not in her area, Derma Pro does have different, different trainers for different states. I think it's very important for people to get the training and not just grab a scalpel and start performing on people, because I've seen too many people, they do it dry and then they look like they're scraped up on their face, and they leave not happy. So you just lost a customer. So that's kind of my thing. I think it was a great, very informative. I loved it. I hope everyone else did. Lori, do you have any parting words? Anything that, I mean, I know you train on Dermaplane and you work in a school. If they have questions about training, can they contact you also?
Absolutely. You can contact me on Instagram. I am Skinology Pro. On Facebook, I am Skinology. My website is skinologypro.com. You can reach me at lori@skinologypro.com. You're welcome to call me. My telephone number is listed. You can text me. You can message me. I'm available all of the time. And this is such a great industry, because when I got into this industry, what I love about it is there's room for all of us, and we build each other up, and it doesn't do me any good to not give you the information you need to be the best you can be. So if you have questions and you become a better esthetician, then we all raise the bar for all of us. So please reach out. Don't be afraid. There are no stupid questions. If you don't want to ask it in public, you can email me and I will be glad to answer any of those questions. We do offer advanced training at the school. We have multiple classes. If you're interested in chemical peels, facial cupping, high frequency, those types of things, let us know and we can get you hooked up. Microdermabrasion as well.
All right, Christina, I don't think you heard the question, but Lori and I went brain dead on how to pronounce the ingredient in the spot treatment.
Oh, yeah, she was right. It's kale and clay.
Yay!
Yeah, you're right.
I love it when I get it right.
I was thinking she was spelling something totally different. I'm like, I don't know that ingredient in that spot treatment.
I
love that ingredient.
Out of the PowerPoint share to get back to unmute myself to say, I was like, kale. So anyway, so that's why I couldn't do it.
Okay, well, all right.
Bonus points for getting it right.
There you go. All right, I think we're done. We kind of went over our time that we try to keep it shorter, but it was very informative and we'll get back to you next week.